Welcome back to the Run Radio podcast. My name is Trina Wilcox, and on this podcast, we talk about all things resilience, and that includes people from the chronic condition community, people with arthritis, and that brings me to my guest today, Dr. Pinn. You are the honoree of orthopedics this year at the Arthritis Foundation of St. Louis's Bone Bash, so congratulations on that. What have you learned most and been proud of working with the Arthritis Foundation of St. Louis?
Yeah, first of all, thank you very much for having me on the podcast. True honor to be on here. And to kind of talk about the Arthritis Foundation, first start from where I first started working with them about 4 years ago, which initially started as a educator on panels for the Arthritis Foundation, multiple educational events, and really being able to teach patients in our community here in St. Louis about arthritis and different types of arthritis and different treatment options for arthritis, and just educating employers and employees at the workplace, and also patients out in the community at big community gatherings. And so that's what my introduction to arthritis was, what the Arthritis Foundation was. And I'm honored to be the medical honoree this year. So look forward to the Bone Bash this year, where we can celebrate together. The Arthritis Foundation has been, a great foundation to be able to really spread the awareness of arthritis, both locally, regionally, and then obviously nationally, through a medium of social media, online community engagement, marketing events, where we can really get patients of all ages together to come together for a good cause, whether that's a run or a gala or a fundraiser in the city and the inner city, or just education events at the community college or at the universities to help educate really patients of all ages. So they've done a great job here in St. Louis, and I've been really fortunate and blessed to work with them for the last 4 years.
The Orthopedic Center of St. Louis, what could somebody expect when they walk through your doors? How can they feel? What's it going to be like for them?
So I'm one of the shoulder and elbow surgeons here at the Orthopedic Center of St. Louis. We're based in Chesterfield, right off the 64 highway on the north outer 40 road. You won't miss our building. It's got big fountains in the front, a big lake in the front. So it's pretty visible from the highway. Anytime you drive out west of Chesterfield, you see us on the north side of the highway. And so the practice has been around for about 25 to 30 years, and it's really been intertwined in the community here. The Orthopedic Center of St. Louis, what we really pride ourselves in are what we call the 3 pillars of care. And so the first one being world-class care, providing expert specialized care in really all parts of the body for orthopedics. The second part of that is leveraging that to really use your research and innovation to be able to make sure that we are providing the best care and collect data, patient-reported outcomes, and data measures to make sure that we are, and then and prove that we are doing a good job, and then converting that to innovative ideas and treatment modalities. And the third is being able to do this in a method that's sustainable and to allow us to grow in a sustainable pattern, both regionally here and also in the city and also regionally. So
what's something that's on your radar that you personally enjoy watching the development, the innovation take place, and that you are hopefully going to be able to bring to your patients?
Yeah, orthopedics has been a very innovative field over the last 10 years, really watching the changes and the sentinel improvements in both surgical technique and also the different non-operative treatment modalities that have really taken off. Has been really amazing to watch over the last 10, 15 years. Now, at the Orthopedic Center of St. Louis, we have different doctors that specialize in different body parts. And so really we allow patients to get the best care specific to their body part with specialized care. So we're able to collect data on all of our patients. And so what the data allows us to do is it allows us to take the world-class care that we're taking, put data behind what we're doing, and then really understand what treatment modalities, both non-operative and operative treatment options, really provide the best patient-reported outcomes. So really, we provide world-class care, but we leverage our data to provide the best care.
What's something that as a patient you would like for us to know that we could be doing better to take care of our shoulders and our elbows, like on the daily?
Yeah, so in general, as you get older, the way I think about the shoulder is, the tendons and ligaments around the shoulder are kind of like a brand new sock. And so you imagine a brand new sock that you're born with this brand new sock with all these tissues around your shoulder. And it's this thick piece of tissue, thick tendons, thick ligaments. And as you age and you use your shoulders over time, that sock gets thinner and thinner and thinner, and it's more likely to tear. It's more likely to have a hole in the sock after you use it for 5 or 6 years. So in our bodies, same thing. As you use your shoulders over your many, many years, you're more likely to have a tear, more likely to have issues as you get older. So really making sure that the tendons and ligaments and muscles around the shoulder are in good shape. So making sure that you're active, but really being able to exercise with your arm in positions where you're limiting your risk of tearing anything. For example, really modifying your activities to where instead of lifting heavy weights for low reps, it's really more reps with less weight. Additionally, in general, keeping your elbows close to your body tends to protect your shoulders. So if you really want to work on your deltoids, instead of doing lateral flies, doing forward flies, instead of doing push-ups with your arms away from your body, pulling your elbows close and doing push-ups close to your body. If you start doing pull-ups with your arms away from your body, pulling them close. So really pulling your elbows to your trunk and to your body, so it allows you to avoid your rotator cuff and your ligaments to have an injury with your elbows away from your body. So that's typically what I tell patients is, our goal here at the Orthopedic Center of St. Louis, and including myself, is to return you back to all play and all activities that you enjoy doing. Having said that, we usually recommend certain activities that usually protect your shoulders, protect your knees, protect your hips and ankles a little bit more. And if you can avoid the ones that are provocative or can cause issues, we try to recommend against that.
What's that like for you when you've got an athlete that comes in and maybe that's their career and you've got to help get them through there? What kind of pressure is that for you? What's it like to see them come out on the other side?
Yeah, a lot of people ask me what it's like to being an orthopedic surgeon. I can tell you that it's the most gratifying feeling to being able to get a patient back to what they like and love doing, especially in a setting of an athlete returning to high level sport. And so that is a large number of my patient population trying to return to high school, middle school, D1 sports, and even some semi-professional sports. And so that's something that I find very gratifying, and also very 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 integral to my wellness as a physician, being able to take care of those patients. So I think surgery is the most intimate thing that is one of the most intimate things that I'm trying to convince someone to do with me. And so it really requires another level of trust that this patient has to have in me. I have to convince someone to go to sleep and then use a scalpel to cut them open. And so it's one of the most intimate things. And so and you have to really trust your surgeon to be able to do that. And so that level of trust is I don't take that for granted, and I truly understand the importance of that, and I really try to use shared decision making to try to really help patients understand and trust me as a surgeon.
I love that. I appreciate that you respect the patient's perspective because it's so scary to, you have to turn over full trust that you know exactly what you're doing, and it needs to be a good relationship for
Yeah.
sure.
Yeah, that's right. So, there's all these statistics on complication rate and infection, bleeding after surgery. But, what's most important is really you trusting that your physician's going to get you through that. And so that's really the cool part of surgery. That's why I like doing what I do. And so that's what, and returning patients back to things that they love doing. There's nothing more gratifying than that.
Well, since that is such a high priority, what would you suggest to someone that may not be accessible to you in the St. Louis area, but they need to find a surgeon they trust? What are your top questions that they should ask? What should they be doing to make sure they get connected with someone that they can have a great relationship with?
Yeah, great question. I think the things that I want my patients to look for in a physician is the same thing that I look for in a physician. Is one, are they going to give me this world-class care, the best care in town, the best care in the nation? And, are they trained enough to be able to do that? And so that's what I'm trying to understand, and I'm trying to impart in patients is that, at the Orthopedic Center of St. Louis, we provide that. And how do you understand that, understand whether a physician is going to do that? And so really asking your physician when you meet them, what type the hard questions, like, how many surgeries do you do? How busy, how many times have you done this? What are my complications if I have this type of surgery? Um, and what is your general patient outlook, and how do you approach patient care? And so really, one, understanding what that physician can provide as from a world-class care perspective, but then also you have to, in the office visit, feel comfortable and with the doctor, and whether it's the compassion, whether it's the personalized care that they can provide, really feel comfortable on an emotional level with the physician to be able to proceed with any sort of surgery with that doctor. So, really understanding, one, whether you're getting world-class care, and then if you're getting personalized, compassionate care. And those are really the two things that we pride ourselves on, and I pride myself on. And then once you can get those two things, really, you know, it's all about accessibility. And so, accessible, quality, world-class, compassionate, personalized healthcare is really difficult. And there are a lot of uh, groups and physicians that are, booked out 6, 7, 8 weeks. And so we're really able to see a lot of patients. We have a number of mid-level providers who will help screen our patients from acuity. And so it allows us to really see patients and really be accessible to patients in the St. Louis area. So mostly we're able to see patients in 1 to 2 weeks.
Oh,
Uh,
excellent.
and so it's what we can offer being in private practice, and we pride ourselves on that. So not only providing world-class care, using research and innovation, and leveraging our world-class care to provide the best care, but then also being accessible to patients.
So July is JA Awareness Month. Have you had a lot of kids that come through your office?
Yeah, so we do see a number of kids. Typically the JA, so juvenile rheumatoid arthritis, juvenile arthritis typically goes to the pediatric orthopedist
Mm-hmm.
in town. And so the peds hospitals tend to see a lot more than we do, but we do see a little bit of that.
What is something that you might tell a kid that is looking like they may face some sort of surgery in the near future because of arthritis?
Yeah, it's a tough conversation to have with patients. Luckily, we're able to avoid surgery in most children, and really the advent of oral prescription medications to help combat um, rheumatoid arthritis and a GRA, and gouty arthritis and inflammatory arthritis really has changed the game in terms of um, the type of care that we can provide as orthopedists, but also the type of care that rheumatologists and primary care doctors can provide. Orthopedics, about 25, 30 years ago was founded primarily on rheumatoid patients. And so we would do a lot of total knee replacements, total hip replacements, on rheumatoid patients. Now those rarely come into my office. And the reason why that is because the medications are so good and so much more powerful to try to treat rheumatoid at a much earlier stage, that those patients don't end up needing a replacement surgery down the line. So it's pretty amazing what rheumatoid arthritis and a lot of inflammatory arthritis have done, and the treatment of that has done over the last 10, 15 years.
Yeah, that's really good news. What's the number one injury that you treat? Is there one?
Yeah, so I would say the number one injury that I probably treat so I just do mostly shoulder and elbow surgery. And so I would say out of that, 70% of my practice is shoulder. I'll do some general call, lower extremity, but mostly 90% of my practice is shoulder and elbow. Out of that, I would say 80% of my practice is shoulder. And that's an even split, I would say, between open and arthroscopic shoulder surgery. And so a large amount of what I see in the office are rotator cuff repairs and labral tears. That represents a large portion of what I see and I do on a yearly basis. And then the second kind of part of what I do is a lot of shoulder replacements. And so it's a lot of shoulder arthritis, chronic rotator cuff tears, chronic rotator cuff arthropathies, degenerative changes to the shoulder that need surgery. So that's kind of where I live, is between the rotator cuff and labral repairs and shoulder arthritis or rotator cuff arthropathy. So
very good. All right. Anything else you can think to share with us? I'd like for you to give the address, tell people how they can get in touch with you.
Yeah, 100%. Well, if you just type in, the Orthopedic Center of St. Louis, we've been here for, again, 25 years. We have specialists in all parts of the body. We can really see arthritis of all parts of the body, but really any orthopedic injury. And we really pride ourselves on world-class care and really being able to do that to provide the best patient-reported outcomes. Now, in order to get a hold of us, you can just go to our website. It's toc-stl.com. Otherwise, you can always call our office number, which is 314-336-2225. Alternatively, you can just, if you want to see me as a physician, you can just go to drpinn.com, so drpinn.com. There's a schedule an appointment button there that you can schedule appointments through. So we try and make it as easy as we can and as accessible as we can for patients.
Awesome. Definitely appreciate that. Appreciate your time, and also appreciate you partnering with the Arthritis Foundation of St. Louis. Thank you so much for what you're doing in the community.
Of course. Thanks for having me.
No problem. Thanks for following along. You can catch this episode and others when you link over to whichever platform you want to watch or listen from runradio.net.